Okay. All right, Dr. Len, now give us the good.
This is a 57-year-old woman in South Georgia that called me and said, my doctor wants to put me on insulin. This is her 3-month average. For those of you that know blood sugars, you're going to see she had a high of 497 and a low of 381. Average blood sugar over 3 months, 383. Ask Jamie sometimes, how serious is that? Now, I went after this because she has already been on metformin. She was already on a drug, and that was the result of the drug. The next step was she needed insulin almost immediately because of the cardiovascular risk factors. The date on that was May 9th to the 12th. On May 13th, we started a protocol. I used glucose, 2 capsules with each meal and at bedtime, 4 a day. I added Candy Kill, 2 capsules with each meal, 4 times a day. And I added, because I found that theanine has an amazing way of working overnight to help consider fasting blood sugars in the morning. So I put her on sleep time with a high theanine content, 3 to 4 capsules at bedtime. That was 12 days ago. I got this morning.
Wow.
Wow.
Huge.
Oh.
Now, you could talk to a million doctors that deal with blood sugars, and you would say that that's virtually impossible. Now, again, teaching your clients, your practitioners, that you have tools out there, but not to be afraid of dosing on the high side till you get the results you need.
So Dr.
That
Len,
is,
would you repeat the protocol one more time?
the protocol was glucose, 2 with each meal and at bedtime. That's 2, 4, 6, 8 capsules a day. Candy Kill, right adjacent with it, 2 with each meal and at bedtime. And then I've just started to do some research on theanine. I like that as an ingredient in sleep time. And I went with 3 capsules at bedtime. Now, she wasn't having any blood or any sleep issues at all, but we added that on top of it. Her comment to me was, when she started getting these results, she said, "You're a genius." And I said, "No, I'm not." I said, "It just works with science again." So there's a prime example of utilizing the tools you already have that you typically see people using 2 capsules a day. Oh, my blood sugar isn't doing anything. Well, we heard about Candy Kill and the berberine that's in there, but we don't really, but if you get aggressive enough, and you can talk to your practitioners about getting aggressive enough with protocols, you can make it a substantial difference. The next thing I want to talk about, one of the questions that I got was, what about this fish oil thing? What about the thing that we saw, this fish oil concept that we saw that was out there?
Oh, this is Shelby's question. Got it.
A couple things come to mind as I read the article published in the British Medical Journal. And it said fish oil supplements could raise the risk of a heart attack or stroke. It showed in patients in this study. Now, let's keep in mind a couple things. This study came uncontrolled, I'll say that a third time, uncontrolled, from China. Consider the source of these all the time. This is a study of studies. This was not a real study. This was looking at research that had already been done in China. So they looked at these and they said, this is really strange. We saw this increased risk. One of the things that was never factored into this study was the viscosity of the blood of the patients prior to having this. When you looked at the research that was done on those that did suffer a heart attack or a stroke, we saw their fibrinogen levels were through the roof. So they had sticky blood from the very get-go. When you put fish oil on top of somebody that already needs to have their blood, quote unquote, thinned, you have the potential for an accumulation of lipids, which could cause that kind of problem. Could. Now, also in the tail end of this was those that had existing heart disease. When we added it, it lowered fibrinogen and it ended up saving their lives. So there was a lot of positives came out of this. I was really disappointed that Fox News was the one that published this one and used it sensationally. It quickly disappeared, but there is virtually, and I got to say this, virtually no risk factors involved here. Even though they said it was 12% and 6% inside of the study, it just wasn't there. Now, the other thing that comes to mind, when you looked at the reviews that have been done of this study, that when you look at quality control and you look at lipids and you look at fish oil and you look at what are called pelagic fish versus non-pelagic fish, fish where they're caught, the raw materials that are utilized for the production of fish oil. Again, I'm going to go back to the day I started with Jamie. When he came in and he said, you need to at least carry our fish oil. I didn't carry a single NF product. And he came in and I said, let's just talk about that. And I said, look at this. If you catch deep water fish, you have less toxicities. You have less things that can come out of the ocean. So when you use sardines and anchovies and you use the deep water fish, the risk factors are down dramatically. In a country like China that has the highest pollution rates in the world, even in their oceans, when they use the fish that are caught right offshore, which is an inexpensive way, you're going to have toxicities that run in with those fish oil capsules as well. There was an asterisk attached to this article that was reviewed that said, if you are buying, I don't know if you got deep inside of this article, if you are buying your fish oil from Costco or Walmart, reconsider it. Quite a blow to their fish oil. So again, quality, quality, quality. Don't have to worry about issues. Okay? Next thing, we're going to talk about me in particular, and I want to run through this. I'm not going to spend a ton of time here, but when we were looking at the number of issues that I had, and this is going to be the same thing for any practitioner dealing with any patient. When you get to know that patient, you understand what they have. We tend to practice with blinders on. Oh, I've got arthritis, and that's the only thing we look at. When you look at the quarterly protocols that were done, and the talk that I gave a couple of weeks ago, when we said, if you look at allergies, you look at cardiovascular, you look at orthopedic, and you can say that there is a direct link that puts all those together. So whenever anybody has said to me, what do you think about those quarterly things? And I said, I don't know how much thought was put into getting those three groups together, but if you look at this and whatever quarterly group is put together, studying it and understanding, and I talked to Mikey about this a couple different times, making sure that you can find, and it doesn't take a lot of work to find a corollary between all of those. So when you look at proper protocols and you look at what was done through these quarterlies, when you look at, and I'm going to put it to the top, you looked at nitric oxide production using CircuCore. If I could just isolate there and find one prep that crossed through allergies, crossed through orthopedic, went through cardiovascular. Boosting nitric oxide and using that one aggressively as well. It can be used to control blood pressure. It can be used for a lot of cardiovascular supporters, but we're finding more and more research of nitric oxide becoming such a huge entity. So when you have issues with joints, when you have arthritis, when you have had surgery, you've had a torn ligament, the more nitric oxide we can push through the body, the better things like hyaluronic acid can work. So I'm going to go through my list real quick. Top 12 list for Len. Number 12, starting at the rear end, is my men's multi. Now this can be the women's multi, the Frontier, using the correct formulas, looking at that as a foundational prep. I'm putting it at position 12. Not that it's down the list because it's not that powerful. It's on my list because there's a lot of other things that need to be built on this. Number 11, Frontier Biotics. I love that prep. I use that aggressively. I don't have a single patient that I don't have on 4 capsules a day of that. If I'm dealing with acne, I'm using it up to 6 to 8 capsules a day, and I'm finding dramatic results. If I'm dealing with Helicobacter pylori or ulceration in the stomach, I'll use this up to 16 capsules a day. So you can use this aggressively for any irritable bowel issues, any kind of issues at all. I have a history of constipation that goes back all the way into my 30s. That is one of the preps that really helped get me back on track. Number 10.
Len, quick comment for the group.
Sure.
Because my one of my top formulas is superbiotics for years. And it's the only thing that really helps me. We've been out of stock. I even ran out of my personal stash. So I finally said, I'm going to try the Frontier Biotics. I know it's a low dose. I only use 3 a day. Took me about 4 to 5 days, but the last couple of days, dramatic change.
It's amazing.
Yeah.
It's a very unique formula, and I like the way the label reads as biotics. You know, I have somebody that says, oh, I'm suffering with this. You can use this aggressively to try to stabilize things.
So
Number
my point
10.
to the team is don't always get jammed up with the dosing.
Right.
You can always take more caps of these, but I was even surprised how well 3 caps worked when I was taking 1 to 2 superbiotics every day for years. And I remember Dr. Tracy mentioning it may be good sometimes to change up the bacteria using, even though it's very similar, it's good sometimes just to change it.
Next on my list,
Mm.
Mega K2 Plus, a relatively new strength that was a relatively new addition to the line. It made my number 10 on the list.
Mm.
Why? I have found that blood viscosity is a critical factor. Why? Because I'm trying to keep this thing up here going. As you proceed, talk to Joe, through your 60s, closing in on your 70s. I'm already past Joe past on the age thing.
That's why I love you, Len. You're the only one older than me.
I'll always be older than you, but
know.
it keeps the flow of blood through the blood-brain barrier going properly. It's amazing. Now, when I have issues, and one of the questions we came up with was dealing with eczema or psoriasis. Keeping in mind, the skin is your biggest detox pathway. If you keep sufficient vitamin K flowing through the body and not be paranoid about this, a lot of doctors are paranoid about vitamin K. If you use it properly, you can do amazing things with skin. I typically will use Mega K2 Plus 2 twice a day, a lot of vitamin D. I will also use HA Plus 2-3 times a day for a period of time till I start seeing changes in skin with eczema. You know, one of the questions was, how do you start out with that? And most times we've gone to gut health right off the bat, which is another good idea. But I want to try to get stabilization of the skin. Now, I will tell you that little dog that you see over my shoulder, every now and then, if I'm playing with her, she would, you know, the teeth come out. And I will get a bite and I will get a mark on my arm of some sorts, you know, along the line. You can see one right there. When I do that, and you see a lot of seniors that get these splotchiness on their skin, it's called lipofuscin, the age spots. They take enough of this K2, and typically if you even use 2 a day, you can get better skin health. Ladies, you want to try to get rid of wrinkles? I have seen that hyaluronic acid, along with K2 plus, makes an amazing change in reducing wrinkles. I don't know if any of you have seen the commercials on TV right now that hyaluronic acid taken orally as well as topically just got an indication for vaginal dryness in women. Now, that may not seem like much, but it's guesstimated that married women, nearly 60% of them have a problem with that. Taking hyaluronic acid and some vitamin K can help, along with probiotics, to moisturize the vaginal tract. It's not one of those things you walk into an office and you start talking about, but it's something that's out there that is a very big problem with a lot of people in today's world. Number 9, SPMs. Jamie first introduced me to SPMs as an analgesic when I had broken ribs. I have not found anything as powerful as SPMs for turnaround. I am using SPMs along with a lot of other entities to reduce inflammation in my body and to make sure that any ligaments, tendons, etc., that get overworked as I swing a golf club is not a problem. I go golfing with guys in their 30s and 40s that come in and, oh, my back's killing me, my legs are killing me at the end of 12 holes. I'm ready to stop. SPMs keep me going. I am also thoroughly convinced that SPMs have an amazing antiviral, antibacterial effect. And I'm using it as a first line to keep my allergies under control, as well as any potential infections. Seen walking around, see people starting to wear COVID masks again. You know, I feel like I need a patch that I can give them saying, take that mask off and take some SPMs and you'll be just fine. Number 8, HA plus. It's not the top of the list of the analgesics. It's not on the top of the list of antiarthritics, but I have found more information on hyaluronic acid recently as far as helping with ligaments, joints, and I will tell you this. I've done a testimony before that when I had my knee replaced, because I played 1 year of professional football a long time ago, had my right knee replaced, and they had done scans on both of those, and my left knee was full of arthritis, and they said it was just a matter of time. Well, 2 years after I had my knee replaced, I got my knees re-x-rayed after I started HA plus, and I have 0 arthritis in my left knee. I have full flexibility. He says I have the knees of a 20-year-old. Now think about that and think about the people you see limping around. So again, be patient. It doesn't happen overnight, but you might have to go to a higher loading dose. I've gone as high as 6 to 8 capsules a day for a period of time till I start getting that hyaluronic acid through the body. That form in HA plus is a very small molecular weight. It can be absorbed through the gut and gets into the bloodstream very rapidly and can get to the sites of inflammation in the body and starts to rebuild rapidly. Number 7, adrenal glandular. Another new entity into this, and I will tell you this, when I first started studying for my naturopathic degree, and I was at the University of Cincinnati, I was first introduced to adrenal glandulars and the effect of adrenal glandulars on the human body. I would have to, again, by my research, say that nearly 7 out of 10 people that I come in contact with are adrenally shot. Stress, life, kids, marriage, divorce, you fill in the blanks. And I know a lot of us turn to Adrenamax, which is my number 6. I keep that as number 7 because I keep the 2 of them in place. I take them both. I take 2 adrenal glandulars each morning. I take 2 Adrenamax 2 twice a day. I don't want to go back to the days of stress. I don't want to go back to the days of feeling my stomach churn. It's an adaptogen with Adrenamax, which means if my stress levels and my cortisol is high, it's going to bring it down. If my cortisol is low, it's going to bring it up. So it helps to maintain my energy during the day. So I don't get that late afternoon fatigue and have to run for another cup of coffee. So again, adrenal glandulars support the gland itself. I got to tell you, it's guesstimated that 70% of women over the age of 40 are on a thyroid prep. I'm saying that 70% of women over the age of 40 should be on an adrenal glandular. It would make their life a lot smoother. That communication pathway between the thyroid gland and the adrenal glands is a crucial factor. So when you look at how does the brain communicate with the body? Hypothalamus, pituitary gland in the brain, direct signaling down the spine to the adrenal glands sitting on each kidney. If the adrenal glands can't receive that signal by utilizing cortisol, DHEA, and your sex hormones, we're going to struggle. And when you look at Alzheimer's and dementia and memory lapses becoming a major issue in this country, adrenal glandulars have now become my foundation for anybody past the age of 40. I want to protect your brain. I want to keep you going. Adrenamax, just to make sure that I can maintain my cortisol levels properly. Number 5 on my list is N-acetylcysteine, NAC. I've had a history of kidney cancer way back in the day. The one thing that I haven't been able to correct in my system is gout, which I received again from my father. We passed that one down. N-acetylcysteine has kept my uric acid levels where they need to. Kidney disease is now the number 1 killer in this country beyond, right below cardiovascular disease, chronic kidney disease. If we're going to look at one way, there's many ways. One way to protect the kidneys, and acetylcysteine 2 twice a day can make an amazing change. Number 4 on my list is magnesium. Mag Complete, which is now, I got the email this morning, back in stock. I'm going to share a study quickly with you because the gal I showed you her blood sugar, how am I going to keep it there? Does she have to stay on that high of a dose? This is an interesting study that just came out that said magnesium deficiency is linked to metabolic syndrome. So for the first time, it says magnesium activates insulin. I've never seen that before. Magnesium activates insulin. With magnesium deficiency probably being the #1 missing entity in the lives of almost everybody that you come in contact with, if we want to increase metabolic syndrome help, the reason the people are overweight, we want to add nutraglutide and we want to try to put them on a weight loss protocol. If you don't add magnesium to that protocol, we're not going to intercept insulin properly. So if you want to hit a home run, you really want to start that weight loss plan. This was published in the Journal of Clinical Endocrinology and Metabolism 2 weeks ago. I'll send this to Christine to send out to you. Continuously low magnesium levels affect insulin functioning, rendering it almost completely ineffective in impeding metabolism. As a result, magnesium deficiency will contribute to weight gain. Magnesium deficiency will contribute to weight gain, diabetes, and prediabetes. And this goes on and on about why are doctors not doing magnesium levels? Because if they do, they typically recommend magnesium oxide, one of the worst forms. So when you look at Mag Complete, you look at an entity like that as becoming one of the most important entities for full body functioning. Number 3 on my list, sleep time. I participated
Wait a minute. Hold on.
Okay.
You went from 5 NAC. So are you saying number 4 is Mag Complete?
Mag Complete's number 4.
Okay, because you're
Yeah.
talking about magnesium. I just wanted to be clear. Because I'm going to make a poster out of this, I think, Dr. Len. Dr. Len's top 12.
Okay.
We're going to have to
I think
pimp
it's a
this
good
out.
idea because, you know, let's say you make a poster out of this and you go to see your practitioners and you show them this list and say, how's your movement going on this list of 12? These are
I
all
also have a
basic,
question. I also have a question
foundational.
for you. So you mentioned something about women over age 40 on or 70% of women over age 40 are on a thyroid prep.
Yes.
You would move them off of Thyroid Complete and put them on an adrenal glandular?
No,
or
no,
would
no. I didn't even talk about Thyroid Complete. You know, Thyroid Complete. What I'm saying is, and I didn't finish that. Thanks for bringing that up.
Okay.
Brain communication down to the adrenal glands. The adrenal glands, if they're suffering, if they're having problems, call out for help. There's a signal that goes, feedback mechanism from the adrenal glands back to the brain, to the pituitary gland that says, I need help. First line of help that the pituitary gland does after it notes that there's an adrenal deficiency, it raises TSH.
Oh, okay.
So thyroid stimulating hormone goes up, signal goes to the thyroid, release more hormone. So as we continue down that, the adrenals are fatiguing, we end up having the need for more and more thyroid. So I'm saying the adrenal glands have been overlooked for the last 10 years. That led to the primary need for so many individuals being on thyroid preps.
So would you put somebody on both the adrenal glandular and the Thyroid Complete?
Yes,
Yeah.
absolutely.
Both. Okay.
If they're on, let's say it's even a Hashimoto's case, you know, Hashimoto's thyroiditis, I would go with the Thyroid Complete and then get them past the fear of taking something simultaneously with their prep. You know, they're said to take it 2 hours before, whatever. If I tell somebody to take 2 Thyroid Complete right with your Synthroid, it gets absorbed systemically right at the same time and starts to work dramatically. I would follow an hour or 2 later with an adrenal glandular. And you're going to see that their functionality, their energy levels, their thyroid numbers will continue to improve. Back to number 3, sleep time. I have a history of sleep difficulties. And again, where I met Jamie back in the day, when we were dealing with a company called Neuroscience and a prep called Cavanase, and it disappeared. And we said, we can do this. And Sleep Time was launched.
Excited.
And I love the concept. I love the need. Now, right when this prep first came out, I was involved at a study at the University of Pittsburgh Medical School. And we took 12 residents aside and had them, as they're going through the residency program, days that they would run 24 straight hours or 36 straight hours and get very disappointed sleep habits. And we used the sleep lab there. And we said, we're going to factor out exercise. We're going to factor out food. We're going to factor out everything. All we're going to do is see what happens when they get restricted sleep. And what we did body mass analysis on these guys and gals. They were all young, late 20s, early 30s. And what we found was as little as 14 days of impaired sleep issues affected their metabolism to such a point that they increased body fat percentage by almost 10%. All diets stayed the same. The longer that went on, body fat percentage went up as high as 20% higher. So when you address a weight loss protocol, well, I sleep okay. We'll go back to Joe saying, you know, do you wake up to pee or do you pee to wake up? Which way is it here? And you talk to most people and they wake up at least once or even twice during the night, which means they're not sleeping fully. So utilize sleep time aggressively. It's not going to hurt anybody. That if you're really struggling, take 3 before you go to bed. If I wake up at 3 o'clock in the morning, take another one. Very rarely do you see a hangover effect with this, but it works dramatically and it's an excellent prep. It's number 3 on my list.
Len, just a quick comment for the group. The bundle that works great for me is Sleep Time with Mag Complete.
Yep.
And if I'm really need an extra little kicker, I do the
CBD.
triple. I combine it 3, 3, and 3. Sleep Time 3, Mag Complete 3, and CBD gummies for 3.
Nice.
If I that's if it's on a school night and I want to sleep a little bit late.
Number 2 on my list, buffered vitamin C. One of the questions that came up, he says, what's the deal with buffered vitamin C? What are you talking about there? Let me just go over this. One of the reasons that I like buffered forms of vitamin C is that it's buffered. So if I go back and say, how did I find this list? How do I know that this list is proper for everything that I'm dealing with? One of the things that I've strived for is the understanding that the human body is supposed to operate at a neutral pH, which means that because 70+% of our bodies are fluid, the net of having it stay to the alkaline side is critical. So at some point, I'm going to talk to Jamie about carrying pH strips. They're simple, they're inexpensive, where you do a first morning urine screening. I do that at least once a week. First thing I get up in the morning for the day, I hold this in my urine stream and I look at the pH. It's the same thing you use in a swimming pool. If a swimming pool becomes too acidic, it starts to grow things. Same thing happens in the human body. So if I'm taking every one of these supplements, and as I introduced every one of these supplements, I wanted to make sure that it did not affect and made my system more acidic. Buffered C gives the body the alkaline nature of calcium ascorbate to help keep the human body on an alkaline side. pH strips to make sure that the patient is maintaining that. Anti-inflammatory diet. Should carry those with you. Pass out. Don't forget food in this whole scenario. Now, I've talked to a lot of you about muscle testing. I don't do that. I know there's a lot of practitioners that do it when they design particular protocols, and God bless them for doing that. If that seems to work for you, that's fine. It doesn't work for me. It never has. So I do, and again, coming from a very traditional side, I really take a look at the pH of the system. Now, let me also say this from a buffered C standpoint. We live in a toxic world. If we're talking about things that we've gotten exposed to, you know, I just came back from a swimming pool and I was exposed to chlorine. Let me just say this. The easiest and safest way to remove toxic metals from the human body is to take enough buffered ascorbate. It is complexing, mobilizing, and can safely excrete toxic metals. Ascorbate loves to scavenge toxic metals, which are double valent cations, such as lead, mercury, etc. They bind to ascorbate. So again, when you do this on a regular basis, it helps the body to excrete toxic metals. It mobilizes and complexes. 60% of toxic metals will leave the body when you're taking buffered ascorbate in urine, 30% in feces, 10% in sweat. Now, to make ascorbate work better, you must maintain proper levels of magnesium. They are synergistic. So when we go back to Mag Complete and you're taking buffered C simultaneously, this helps to recycle the ascorbate in your system. Our bodies utilize ascorbate very, very rapidly. Magnesium helps to donate to it, to help it recycle itself through the system over and over again, over and over again. That is what helps us to keep our first morning urine on the alkaline side. So don't forget healthy levels of magnesium. Also, if you look before the addition that came to proline greens, and we talked about glutathione, and we looked at the ingredients in proline greens for boosting glutathione to the highest levels. Prior to the introduction of that prep, ascorbate was listed as the most effective way in all of the research to raise glutathione levels in the human body. So when you have somebody that we have to raise glutathione,
What'd you say?
it's extremely important.
Yeah, okay.
Proline greens, add buffered C with it. Okay. One other thing that I wanted to throw out, and I'll go to number one. Number one is a group. Number one most important thing in my life, in my supplements, is the Ultimate Shake Proline Greens. And I've addressed this by adding creatine to it. The creatine that you all have is the most effective tool that there is. For those of you that have seen the movie The Chosen, has anybody seen that? I know Rhonda has. I'm now working with the whole crew. Okay, as they just launched season 4. So Dallas, the producer, director, is a good friend of mine now. And I started that whole team. I'm going to start that whole team. It's in progress right now onto that creatine prep. Because they all get, they're filming in Texas again, and it's hot, and they're getting into areas where we're getting muscle cramps, and they're not continuing their filming. So Ultimate Shake, Proline Greens, creatine, even though that's 3 entities, that's my number one. And that becomes, if I had to give up the other 11, I could exist with that one. Okay. Other buffered C protocols. One of the questions was, I know you love buffered C, explain how and why you dose out through the day and how long for specific protocols. When we did the thing on limes, I will use buffered C at 1 capsule every hour while awake, 4 to 5 days, along with specific helping entities to put limes down. Buffered C, if we're using it for a detox protocol, I will use 2 capsules twice a day on a regular, because it's going to take a period of time, up to 30 to 60 days, to help the body eliminate heavy metals that are out there. Next, I want to get into what are the top 10 things you think are most important about the quarterly focus? I was astounded by that when I was asked by Christine to put together the pieces to present this month's quarterly focus. How can you put together cardiovascular, arthritis, and all the pain things, and allergies? How do you find a common link there? So here's my top 10 things I like the most about the quarterly focus. Number 1, cardiovascular disease is still number 1 killer in this country. Number 2, I believe strongly that the protocols using nitric oxide can help substantially to lower the risk factors for stroke and heart attack. Third, I love the link to lowering inflammation in the body. That if our bodies are basically hot from inflammation, there are so many tools out there using X-Flame, using SPMs, and using and utilizing all of the different tools that are in there to lower inflammation. Again, I like the PrEP HA+. Fourth was the joint relationship, that when you utilize hyaluronic acid, which can have cardiovascular protective issues, as well as supporting joint health, it's amazing how those two can tie together to make a difference. Fifth on my list was the relationship to allergies. Do we look at that as a separate entity? I mean, I still think when we followed the protocols that we laid out and we take care of reducing any cardiovascular risk factors, reducing inflammation in the body, soon after that, allergies start to be stabilized, both environmental allergies and internal allergies. Next thing down the list, interesting for 2023, the number one reason for doctor visits, number one reason people went to their doctor was for joint pain. Number one, if we're not utilizing and our practitioners and aren't utilizing the joint support preps, X-Flame and HA+, on a regular basis at high enough doses, that's not on their top 5 or 6 different supplements that they're moving, we're missing something. If that's the number one reason, then the people that are walking in the front door of their clinics is that they got pain in their joints. Next on the list, understanding that when a quarterly focus is laid out, there's thought behind it. You know, you may not think about it when you first read about this, but when it's laid out in a plan and you get a chance to study that, and you can do a customization of the entities that support across different areas, and you can tie it all together. So ask the question, does the quarterly focus interact together? Can that lay out a plan? Because if you can figure that out, or if you need help, I'll help to put that together. Go back and watch what we laid out. It becomes a valuable sales tool, so that when you're going in saying, hey, we got a special going on these various preps, we can come in and say, these preps interact together and can do an amazing job of stabilizing health. Other question I got, what are your favorite ingredients and why? Now that was a difficult one, you know, and I looked at saying, what are my favorite ingredients? Ironically, I'm not taking my first one. Zinc carnosine and immunolin. I put those two together. When you look at GI Complete and you look at IgG, I think those are two preps that have revolutionized things. You know, I'm lovingly called the gut guy, but zinc carnosine, if you look at the research with that ingredient and you look at immunolin and understanding you're one of the few companies, if any, that even have that available. So when we talk about leaky gut syndrome, which again, could be the reason for all of the different cardiovascular risk factors, all of the allergies, all of the inflammation, and you add leaky brain syndrome on top of that, immunolin on a pulse dose. That's how I typically use it. I'll add GI Complete every day for 30 to 60 to 90 days. I'll add immunolin for 14 of the 28 days. So I'll add that to that each morning together. I'll add the IgG to it. I use it on a pulse reason because I want the body to utilize it as a raw material, but not be accustomed to it. We have to be able to have that tissue in the gut and in the brain. The body needs to be able to do that on its own, and immunolin can help to teach that to occur. So I think it's critical.
Hey, Len.
Yes.
I got a question. I'm sorry, Ron. I got a question. Not a question, but I saw some research lately that said D-mannose is also very, very powerful in healing the mucosa. Now we have that UT Cleanse powder with D-mannose in it. what do you think about making that a trifecta, GI Complete, IgG, and UT Cleanse?
I love it. You know, because if you look at what D-mannose is, when D-mannose first hit the market, we put it into the category as like decon rat killer, because it is a sugar that gets absorbed through the gut without being seen as glucose. So that mannose form actually makes it to the kidneys and is excreted down through the ureter. So it's been used for urinary tract infections dramatically. That's why it's in that UT prep. But as it's absorbed and it's reabsorbed through the kidneys, okay, it reduces bacterial inflammation body-wide. So when we look at the tissue of the small intestine, we look at the tissue on the brain, what's some of the causative factors that are involved here? Could be a systemic lingering infection, which is causing that problem. So we see something called SIBO, small intestinal bacterial overgrowth, which is very common nowadays. That can be causing that inflammation of the gut lining, which is causing leaky gut syndrome. So Joe, that's a brilliant trifecta to throw that in there. And I think you will increase the body's ability to actually heal that tissue.
Hey, Len, I have a quick question.
Yes.
The IgG, you said you don't do it the whole time. Would you say more at the beginning or at the end of
I
that?
do it at the beginning.
That's what I
I'll
thought.
put it in for the first 14 days and I take 14 days off, but I continue the GI Complete. I have found that if you use it on a continuation, and I've seen individuals that have used it 2 months in a row, 3 months in a row, every day, all the time. When we stop it, we seem to get a rebound effect. So I want to let the human body teach itself to be able to keep that tissue where it needs to be. That's done by something called secretory IgA antibodies. A link to the brain, to that part of the lymph system that's constantly excreting down onto that mucus lining, keeping it healthy. If we use this continually, we shut down secretory IgA. Okay, so pulse it. 14 days on, 14 days off, 14 days on, and you'll see a much better effect.
So Dr. Len, you used the term pulse before when you were talking about how you would dose. When you say pulse, what do you mean? What is that?
That means I would use it regularly for 14 days. And then the pulsing effect means I take 14 days off. So I lay out a protocol with GI Complete once a day for 60 to 90 days. First 14 days, I'm going to add IgG to it. At the end of 14 days, I stop the IgG. I keep the GI Complete in place. Month 2 comes around. I add it back in at the beginning of the cycle. 14 more days. Then I take it away again. And I'll typically do 3 cycles over a 90-day period, and you can take care of most of those issues. My third most favorite ingredient, so we had carnosine and immunolin as one, is perilla. I got to tell you, I'm using Air Max for a lot of different things. I'm using it now for mast cell stabilization when people have issues there. I had somebody the other day that had eye twitches going on all the time. Oh, my eyes are twitching all the time. What do you take? I added magnesium, I added Mag Complete, and I added some Air Max. Guess what? It stopped. So I've used this for allergies in the eyes. I've used it for weepiness in the eyes. I've used it for skin allergies. I've used it for psoriasis. I've used it for just basic allergies. I woke up this morning and pollen counts were through the roof again. I chewed 2 of those this morning. Head's clear. So it can be used, and it should be in the medicine cabinet of almost every single person. Somebody along the line in every family could use that raw material to stabilize.
Question, Len, do you, you said for mast cell, do you have any other products that you really like for like a mast cell protocol?
The reason that, okay, I'm going to put magnesium and buffered C, because mast cells need to be protected from bursting. Okay, they're carrying histamine around. You want them to be stable. your body's going to produce these things. It's a self-defense mechanism. But if they're always being produced and always leaking out histamine, we're going to run into a big problem. So the MAG and the buffered C gives integrity to the pouch that's holding the mast cell together. So you add Perilla in there with the Air Max, it helps to excrete those back out of the body. So it's going to actually bind up, not all, but some of the histamine and get it back out of the body so that we don't go into histamine overload. Okay, last question I had, and I just want to deal with this. Do you have a protocol for pandas or POTS? Pandas is a staph infection or a strep infection, I'm sorry, of the brain that's now affecting the mental health of kids. It's very difficult, very, very difficult to diagnose. Dr. Daniel Amen has done a world of research on this. The only thing that I've had that has been protocol driven that has helped is colloidal silver. So we go back to the Argentin 23 colloidal silver seems to be helpful. Now, what I have up on the screen right now is dealing with POTS, which is a tachycardia, heart racing that certain, mostly females get that's diagnosed. This is a piece that I did for a friend of mine. And this chart was actually put together with my information at the Mayo Clinic. And this is now being used at the Mayo Clinic for teaching about POTS. Now, it's really overwhelming, but if you look at the top and you see that one of the most predicating factors for POTS is what's called hypermobility or Ehlers-Danlos syndrome, which if you talk to somebody that has POTS, you got to ask that question. And this isn't something you're going to get all the time, but there are 3 different levels. I'm just going to show you this quick. 3 different levels of Ehlers-Danlos. One comes down, and here's POTS over here, if you can see where my arrow is. This is tachycardia, which is coming from aortic root dilation. So the aorta is opening up to the point where we're having the difficulties. The difficulties with POTS is over here, emotional instability and the need for psychiatric help. So those that are battling this run into a problem. Now, the other thing that I wanted to point out to you in here is decreased primary immune system issues. And down here, what Rhonda just asked me is mast cell disorders. So when you talk about stabilizing mast cells, you talk about cardiovascular risks, you talk about POTS, you talk about Ehlers-Danlos or hypermobility. Look at the top page here about what the predicating factor was that ran this whole ship. It's an MTHFR issue. So when you look at that and you say, could I come in if I have somebody that fits some point of this with DMG? Could I flood the body with methylated folate and methyl group donation to help stabilize? So when you get back to that stabilization of mast cells, it's not out of the realm of possibilities to use dimethylglycine to help on that front also. Okay, I think I got through all the questions.
Hey, Len, I had that question for pandas earlier this week, and my recommendation was DMG, Argentin, Silver, and SPMs.
Outstanding. Is this for, how old's the child?
Justin?
I don't,
Yeah,
it came from
she didn't-
Justin.
She didn't specify. She's
But it
just
was
been
a child?
trying to get a protocol.
It was a child? Should be. 'Cause
Yes.
You don't
Yeah.
normally see this in adults. It gets beyond that.
Yeah.
I would suggest looking at Dr. Daniel Amen, A-M-E-N. Look at the work Dr. Daniel Amen has done with this. It requires a very specific mobile MRI to diagnose. You actually have to have the person sitting up during the MRI, and the MRI machine spins around your head and does a 3-dimensional view of the brain, because it's very difficult to find those areas where the infection actually took place. SPMs can cross the blood-brain barrier and reduce inflammation, but you got to have an antibacterial, antiviral in there. That's where Argentin would come in. But again, this can be very, very, very dangerous. So we got to make
Hey,
sure that they're under
Justin.
doctor care, because this can actually cause a complete shutdown of sections of the brain.
I just want to let
Alright.
you know, we have one of our customers, she's an MD pediatrician. She specializes in pandas and she does virtual. So, if you need
What's
me
her
to
name?
get,
What, do you have her name again? Because I think I've
yeah,
actually,
it's Dr. Jennifer Franklin.
yeah, I've
She's at
actually
Phillips.
talked with her. Yes.
Yeah. Yeah.
We've
just
actually
let
Alright,
you
sent
know.
guys.
back and forth.
Well, Dr. Len, as always, you
10 o'clock.
you
We
brought
did
it.
it. Did it in
You
an
brought
hour.
it, brother. So
Awesome,
thank
Len.
you.